Maternal Mental Health Matters talks birth trauma, hosted by Pregnancy, Birth and Beyond. I'm Annalee Atia. Birth Trauma Awareness Week 2020 runs from the 7th to the 13th of September. Throughout the week, tune in to insightful, thought-provoking, and deeply honoring stories and discussions with people who have experienced birth trauma, clinicians and researchers in this area, and maternity advocates working to change the system. In this episode, I'm speaking with mother of two, Kristyn Bengal, about her traumatic birth story. Please note that there are themes and topics within this episode that may be triggering to some. If you've experienced birth trauma, please continue with care. Hi, Kristyn. Thank you for joining us today for Birth Trauma Awareness Week.
Thank you.
It's an honor to have you on. We've spoken briefly before this interview about your birth experience, and you're coming on today to share your birth experience with us and the listeners and viewers. Can you please share with us a little bit about your experience and what happened during your birth? I'll be turning my video off, but I'll be here in the background.
Okay. Well, this is my first pregnancy. And I had planned a home birth with a private midwife. And everything, it was a great pregnancy, everything going well. And then at 36 and 6 days, I woke up feeling really sick. By lunchtime, I had developed pain down in my lower right abdomen. And by 9 o'clock, it was bad enough to call my midwife, who recommended we head over to the hospital and she would meet us there. So my mum came with us, and she's a nurse who's worked in emergency departments for many years, and as soon as she saw me, she suspected it was my appendix. So we went to emergency, and that's where it all started, really. I walked in the door and they could see I was heavily pregnant, so they basically just pointed me back out the door. We tried explaining to them that I wasn't in labour, but they sent us off to the to the birth unit. So I had to walk there, and it was quite painful. They ended up my husband got me a wheelchair at the entrance, and we were admitted at about 11:30 at night. And my midwife met us there. She called the OB who we had employed him as part of the before midwives had practicing rights at this particular hospital, so visiting rights. So he was a part of our birth team. And he advised to just wait and see what happened and get assessed by the surgical team at the hospital. So my recollection of things that night was, I kept declining pain relief. I'd attended calm birth, and I really wanted to be drug-free. And I was assessed by a couple of different people. They did blood tests. My white blood cell count was high. All the signs were pointing to appendicitis. But the surgeon or the surgical registrar who assessed me decided that it wasn't, and it felt like they were stalling because I was pregnant. Nobody seemed to want to make that call to operate. I could see in my notes that in my hospital notes that they were in regular contact with my OB, who kept advising they give me pain relief and just observe. So yeah,
What were they waiting for, Kristyn?
They said that they were waiting for. They said, yes, your white blood cell count is high. Yes, you've got your tender in, all the signs of appendicitis, but they were waiting for me to develop a fever. And my mum, having seen many people with appendicitis before, kept saying to them, that's not, a temperature is not an accurate way to diagnose it. She's got all the other signs. They didn't give me an ultrasound or anything to have a look at my abdomen. They were monitoring me with the CTG and, making sure that the baby was okay. But when my mum asked the surgeon, if it's not appendicitis, what else could it be? He turned his back on her and left the room. And it was, I mean, even though I was laying there in my, in a lot of pain, and a lot of these conversations were happening outside the door, I think that they didn't want to get me worried. I could tell that it was taking longer than it should. I knew from what people around me had said that appendicitis is an emergency situation. And I just felt, and I've spoken to others who were there, that it was purely because I was pregnant that they were stalling. It took him hours to come and see me, and eventually my appendix burst at about 2 a.m. I could feel the pain just intensified so much that I couldn't lay still on the bed. I was literally writhing around. I couldn't speak. So I just nodded to my midwife, and she gave me some morphine, and that brought me back down to about an 8 out of 10 pain level, where I could talk, where I could lay still. And I was assessed again shortly after that, and I think they must have seen that I was fine because I was tolerating it okay. And they just requested more bloods be done at 7 a.m. So it was a really long night. I mean, we got there at 11:30, and nothing happened until 8 o'clock the next morning, when my OB arrived. And from that point on, things were full steam ahead. So I signed the consent form for a cesarean at 8:01, 1 minute after he got there. They didn't have time to, normally before they put you under general anesthetic, they take your jewelry and your nail polish off. They didn't have time to do that. They just rushed me straight through. So it was really tense. I'd spent all night knowing that surgery was a likelihood, but I didn't fully understand that they'd be doing a cesarean as well. I don't know why. I just thought they could take the appendix out and leave the baby in. I just wasn't thinking, rationally about it. So it all it was explained to me very quickly in that moment, and I didn't have much time to wrap my head around it. I'd planned to have a home birth, and now I was in a situation where they were going to do a cesarean under general anesthetic, and it was just too much to process at the time. And I remember when they wheeled me away, they explained that because it was, sort of 2 surgeries in one, and there were a lot of people needed in the room, that my husband and my mother couldn't come with me. So I had to say goodbye to them, and I could see the look on their faces. And I just thought, you don't think I'm going to make it. And, then the panic really set in, where I thought I might not see them again. So it was real. It was real, really compounded in a really short space of time. They wheeled me into the operating room, and it was full of people that I'd never seen before. Just, I think maybe at least 10 people in there. The only people I knew were my OB and my private midwife. So I held on to her hand when they put me under. And yeah, that was it. I woke up, it's funny, in that moment, when I was breathing in the gas, I was trying to remember all the things I'd learned in calm birth, because I was breathing so fast I couldn't, the gas wasn't working because I wasn't taking really big deep breaths. So I'd calmed down enough to breathe in the gas, and then that was it. I was out.
Thank you, Kristyn. It's such a powerful and strong moment to share these experiences and stories, and this particular story as well. I'm really grateful that you've chosen to support Birth Trauma Awareness Week and yourself through telling the story. And I know how I can see how difficult it is to go into that space, and I'm tearing up as well.
It is. I mean, I've told my story so many times, and this process goes through cycles. Like, sometimes I can tell it in a very emotionless way, and I'm perfectly fine. I think, it just depends. I mean, sometimes it takes you by surprise, but that's the nature of it, I think. I woke up. I explain it to people. It's sort of like that scene in Kill Bill where she wakes up from being in a coma for years and her baby's gone. It was, I was very drowsy when I woke up, but I remember, scratching at my face, pulling the mask off, and asking, "Where's my baby?" And I can tell. It felt like no time had passed, but I can tell from my notes that it was between 2 and 3 hours before they took me to see her, and she was in the special care nursery, because apparently my abdomen was so full of pus when they cut me open. They had to remove her first to get to my appendix. She was exposed to that infection, so they took her straight to special care. And my husband said he remembers sitting in the hallway and they wheeled a baby past, and he wondered if that was our baby. Nobody stopped to talk to him or explain it to him. So eventually they did come and get him, and he went in to see her. But she was fine. She had they do the APGAR score was 5 and 9, and it was a precaution because they thought that she may, she was exposed to the infection, so they put her on IV antibiotics. And anyway, I remember when they wheeled me in to see her, my vision was very blurry. They wouldn't let me hold her. They said because I was too groggy from the general anesthetics. So that was my introduction to her, and then they took me up to recovery or to the maternity ward. I can't remember which. And I must have gone down and seen her a couple of hours later. So the very first time I saw her face was a photo, actually. When I saw it clearly, my sister took a photo on her phone and showed me. And yeah, that was surreal. I felt like she could have been anybody's baby. Really? Yeah. There was the whole feeling like I wasn't there. Like I didn't see anything, I didn't hear anything or feel anything. And um, yeah, that was hard to process.
Sounds very, very intense and very disorienting.
Yeah, it was, because I just wanted to get downstairs and see her as often as I could, and I was being pressured quite a lot from the the midwives and the nurses to rest, to stay upstairs and recover, because I'd had abdominal surgery. And I remember later, it might have been day 1 or day 2, they told me they wanted me to stop going down at night to visit her because they couldn't spare the staff to take me down and bring me back up, because I was in a wheelchair. I couldn't walk that distance. So I did spend a lot of time waiting for them to come and take me down to. Mommy, wake up. Yeah, you woke up. Sorry. Yeah, so I definitely didn't visit her as often as I wanted to. And I found out that they'd fed her formula before I'd come out of recovery, and that was definitely without my consent. So that was an extra layer to the trauma. Really, nothing went according to my plan at all. It was totally out of my control. So yeah, that was tough.
Kristyn, do you think, what would be, in your opinion, in your mind, in your heart, the things that would have helped mitigate that experience and be less traumatic for you personally?
Well, I've thought about that a lot, because my situation is, it's so, I don't actually know how rare it is, but it's not common. I knew that the cesarean was absolutely needed, because it was no question about it. I knew that I had to be under general anesthetic, as much as that was a big part of my trauma. There was no alternative. But I do carry I've got a lot of questions about why something wasn't done sooner. If I wasn't pregnant and I presented to a hospital with all the signs of appendicitis, they wouldn't wait 8.5 hours to operate on me. It was acute, because I didn't feel, some people with appendicitis, it can drag on for weeks, and it's just this ill feeling that they have. Mine started that morning, and by 2 a.m. the next morning, it had ruptured. So there was, I definitely feel like there was a bit of hierarchy between the hospital staff at play. My midwife was definitely on board with thinking that it was appendicitis, but it really was out of her realm of expertise. She was relying on the surgical team to make that diagnosis, because until they did, nothing was going to happen. And I think it was the same thing with my OB. He kept deferring back to them, make the assessment, make the call, and they were hesitant to do that because I was pregnant. So really, it was a bit of passing the buck, maybe not wanting to put their own career on the line by saying, no, I think you should do this, if in the event they were wrong. And I think anyone who works in a hospital will tell you that it takes a lot of courage to stand up. You've got to be pretty sure. If you're going to stand up against someone who's senior to you and say, no, I think you're wrong, you have to be fairly sure. So I think there were a lot of factors, but that was probably the main one. The hesitancy to make that call resulted in such a delay that, my appendix burst, and then all the domino effect from that. My daughter wouldn't have been in special care if she wasn't exposed to that infection. She wouldn't have had formula against my wishes. She wouldn't have had gut health issues later in life. Sorry, just 1 second.
No problem. Okay, so we're back.
Yeah, so, the result of my daughter and I were both on IV antibiotics for a couple of days after the operation, and she was very drowsy, compared to all the other babies in the nursery. She spent a lot of time sleeping. I think that must have been the effect of all the drugs that I had that went through to her. She had really bad tummy issues as a newborn, and later on in life, when she was a little bit older, eczema and food intolerances that I think were a combined result of the cesarean, the antibiotics, and then the formula. I just think that killed her, all the good bacteria in her gut. When we were up when she was out of special care, so they promised I'd have her in the morning, and I didn't get her until 6 o'clock that night. So there were lots of little, felt to me like that was their last little show of, well, she's our baby, not yours. That was the attitude that the NICU nurses displayed to me. I had to fight with them and ask permission to hold my own baby. I had to really rustle up the courage to stand up to them and say, no, I don't want you to put a feeding tube in her. I don't want you to give her formula. I want to express and breastfeed her. They were very rude and very, they bullied me quite a bit into doing what they thought was best. I remember my midwife saying to them, she's not a sick baby. Stop treating her like she's a sick baby. She's here as a precaution only. And once we got up onto the ward with her, I felt a bit better, but I was still, I still experienced a lot of the common coercion and bullying that goes on with staff on the maternity ward. One midwife came in and saw that, I'd expressed a couple of, 20 mils or something of milk, and she said to me, is that all you've got? You're going to have to give her more than that if you don't want her to go back downstairs to the special care. So there were lots of threats, and I ended up giving in and giving her formula again. So it was such a relief to get out of hospital where we could just do what we wanted. I was in such a vulnerable state of mind, and I did beat myself up a lot over it later. Why didn't I just say no to them? Why didn't I assert myself more? I knew in my gut that what they were telling me was wrong. I knew what I wanted to do, but I gave in to their constant nagging to, and I sort of deferred back to them. Well, they're the experts. I don't want her to go back down to special care. I'll just do what I'm told. So once we got out of the hospital, breastfeeding was fine. She gained weight. Aside from the tummy issues that she had, and then later on all the allergies, she was fine, and I felt so much better. But I went and saw a psychologist to process this trauma. I talked about it a lot to other mums, to my midwife, to anyone who would listen, basically. And I got all the usual, at least you've got a healthy baby lines, and I felt okay. We started about 16 months after she was born. I fell pregnant again, and we were on holidays interstate at the time, and something wasn't right. My midwife told me I had a lot of bleeding. She told me to go and get an ultrasound, and they discovered that I had an ectopic pregnancy. So again, it was all a mad rush in emergency. They were talking about removing my ovary. They were talking about surgery. It was just, I just went straight back there. And I was lucky that my tubes didn't rupture, so I didn't need surgery, but I had to have injections to basically abort the baby because I wasn't allowed to fly home until my HCG levels were back to normal. So we were stuck there for 2.5 weeks, and I was getting blood tests every couple of days to check. And I just remember that period when I left the obstetrician's office after he told me that he thinks the damage to my fallopian tube occurred because of the ruptured appendix. I was so angry, I just couldn't speak. I was so angry. It just brought it all back because it wasn't over. It was still happening, and the result of their what can I say? They neglected to make that decision to operate on me when they should have, and it resulted in all sorts of health issues for my baby, but also the loss of another baby. And I started seeing my psychologist again after that because that was unexpected that it would affect future pregnancies, but it did, and that was tough.
It sounds immeasurably tough. I don't know if we can quantify it in words or even understanding. Not fully, really, to have to. And that, I don't know a huge amount about trauma, but I have studied a little bit, and I know that the trauma that is unresolved, or it lives within our nervous systems, and it just takes a millisecond for it to come straight back on. With the right kind of triggers. And it sounds like you went straight back into that, having had that experience with, and plus on top of that, bringing up all the old feelings around the anger and the shame and the pain and all of that kind of stuff that's going on from back then. And there's still the unresolved aspects of not having had closure with your care providers from before in a way that was supportive of in a healing way. It sounds like that anyway. That's what it sounds like on my end.
Yeah, definitely. It raised a lot of questions, and it did make me really want to. I mean, we started a complaint with the hospital shortly after all this happened. With my, shortly after I had the surgery, and because it was very clear that, someone or several people stuffed up and hesitated, and it could have been a life or death situation. So many things could have been prevented, and I decided not to pursue that complaint further. The last communication we had from the hospital was that it's very difficult to diagnose appendicitis in pregnant women, and that was that. But they definitely didn't do all that they could to diagnose it. They didn't do everything they could to rule it out. I could have had an ultrasound, but really, I should have been operated on sooner. Yeah, I mean, that was 5 years ago when my daughter was born, or 5.5 years ago, and I go through cycles. I don't expect that I'll ever get over it any day. I know that's not how it works. But yeah, the certain things do trigger it. Going to the hospital, I became a consumer advocate for that same hospital after my second daughter was born, and I had to go to that maternity ward. That's where they were having their meeting in it. Oh, actually, no, it was near the NICU. The meeting room was on the same level. Just being there was, I started sweating. My heart started beating really fast because I remembered that lift, that doorway, that hallway. And that little things like that take you by surprise. Because my second birth was so healing, it really did. Even though it did heal a lot of the trauma from the first, it doesn't take it away completely.
Yeah. Kristyn, thank you.
Thank you for listening.
Thank you so much for sharing your story with us, with me as well, for feeling safe to share that with me in this space, knowing that several other people are going to see this, maybe people you don't know. And this work that you're doing as a consumer advocate and sharing your story here today as a consumer, as a person who's access to maternity care here in Australia, and the importance and relevance of this it's immeasurable as well, because we know that there are so many traumatic birth stories out there, and they often don't get to be heard and recognized and acknowledged. And I just want to honor you and thank you for taking the time out and the space in your mind and your heart to share this story, because I know it's been building for a few days and it's required a lot of you. And so I'm really appreciative of that and thankful to you. And I can see that.
Thank you.
Yeah. Thank you for joining us today, everyone else. If you have any questions or need support yourself, we'll be posting some links here shortly. Please go ahead and make those phone calls or contact if you do need support yourself. And again, thank you to Kristyn and for the work that you're doing as well in the world. And I'm looking forward to hearing more from you in the future as well, and to seeing what awesome work you do. And really, thank you again.
Thank you.
You've been listening to a special series on birth trauma hosted by Pregnancy, Birth and Beyond and brought to you by Maternal Mental Health Matters Australia, a collaboration between 4 peak Australian consumer advocacy groups, Safe Motherhood for All, Maternity Choices Australia, Maternity Consumer Network and PBB Media. For more information, head to pbbmedia.org. If you need support with a traumatic birth experience, or just need to speak to someone, you can try these resources: birthtalk.org, headtohealth.gov.au, panda.org.au, and Lifeline on 131114. Original music by Romy Agam Rom from her album Opening. You can find her music on Apple iTunes, Bandcamp, and Spotify.